travel with your health data. If you are from Bulgaria and you are on vacation in Portugal and you need to go to hospital, then the medical doctor with one click can receive your medical file with your X-ray, with your blood test, with everything.
It's called the European Health Data Space, a proposed cloud-based source of information for patients, doctors, researchers, and companies. Tomislav Sokol of the EPP Group is the lead negotiator in the European Parliament to make it happen.
The whole idea is to make healthcare much faster, much more efficient, that the healthcare professionals, doctors do not have to perform some tests again and again, so that you get healthcare in a much faster way.
The European Commission says on average a patient will generate more than 12 terabytes of personal health data in a lifetime. Health data reuse is estimated to be worth up to 30 billion euros annually and could reach 50 billion in a decade. Highly valuable for patients, governments, and researchers.
If I have my annual check, on my lungs and on my heart and everything, I think what is the new thing about this European health data space is that the patient has access to all its data electronically and can use these data. So you have like a passport, you have everything in it.
And that data is protected.
We know that there is an enormous asset that we would like to put at the service of science and innovation with all the safeguards that are necessary. We are fully aware of how sensitive these data are.
And also a very important point that all of this data will be shared within the EU, so it cannot be stored anywhere outside of the European Union.
Countless businesses could speed their research and development with the European Health Data Space, like a Bavarian company called BrainLab.
Wherever you have an operation, the equipment you use is triggered by software which had been developed by BrainLab, and they need data for further improving what they are offering to doctors, to medicines, and to hospitals.
Pooling that data across the EU can also accelerate the quest for new cures for cancer and other diseases.
Fighting cancer is a long journey. A patient can have different investigations, can go in different centers. You need a second opinion. It's a very delicate situation. The families would like to see what are the options. Having all this in an electronic format also will help a lot the patients.
EPP is leading in the fight for more effective treatment for important disease. We are always a driving force for new oncological treatment, which will be of benefits of millions of people in Europe.
We want better healthcare, we want more efficient healthcare, we want faster healthcare, we attract research and development of new medical technologies within Europe, so that we are not dependent on third countries anymore like we were before. All of these are political priorities for the EPP, and I think EPP is instrumental in making this happen.